Thank you, Madam Chair, and to you and the ranking member, I thank you for this hearing. And I just also want to echo what Senator Kane said about the behavioral health challenges of all of our first responders, not just in healthcare. I've been hearing the same thing from police and firefighters and EMTs in New Hampshire. Among other things, a number of them have just said to me they haven't had a day off in a year. And anybody who hasn't had a day off in a year is going to be struggling with some challenges. So I'd look forward to addressing that issue. I wanted to start with, it's a distinguished panel, and I'm grateful to all of you for your work. I wanted to start with a question to Dr. Muther. Earlier this year, I reintroduced bipartisan legislation with Senator Murkowski, which would expand access to medication-assisted treatment for those struggling with opioid use disorder by eliminating the outdated waiver requirement that keeps many providers from prescribing medication-assisted treatment to their patients. Yesterday, the Biden administration announced steps to remove some of the burdensome training requirements that practitioners must meet before they can prescribe medication-assisted treatment. But there are additional steps that Congress must take to eliminate all of the existing barriers and to ensure access to opioid use disorder treatment for those who need it. Dr. Muther, you have spoken in the past about the importance of medication-assisted treatment and the myths that contribute to the barriers individuals face when they're trying to access this treatment. How do we fully address these challenges and expand access to medication-assisted treatment during the pandemic and beyond?
Wow, thank you so much for the question. That's a big question. I think considerations for the medical providers and how we can expand the workforce to have clinical availability, not only for the medical prescribers, but also for the behavioral health specialists, as I've mentioned. We're facing a workforce shortage, and so if we don't have clinicians available, and if we don't have clinicians working in the right places, we're never going to meet the need. There are so many other barriers to care that I've mentioned for patients as well. And so, stigma has been touched on. There's the logistical and logistical barriers such as transportation, conflicts, work conflicts, and so forth. So we need to eliminate the barriers to care and make care accessible. One thing that we've done is right at the start of the pandemic was related to home-based inductions. And developing rapport with patients and building trust so that we know we can do home-based inductions, for example, safely and effectively. And there's also tons of room. I think 95% of our encounters at Salud by behavioral health clinician have been done via telehealth. And that is not only as effective, in many ways seems to be more effective in meeting the needs of that population. So it's really about eliminating barriers to care, building the workforce, and building that rapport with the patient community.
Thank you. I appreciate that very much. Let me move on to a question to Dr. Benton, because I want to turn now to another devastating public health crisis that we've talked a little bit about this morning, and that Congress has to work to address, which is the issue of youth suicide. In 2017, Martha Dickey from Boscawen, New Hampshire, was traveling for work when she received a phone call that is every parent's worst nightmare. Her 19-year-old son, Jason, had died by suicide. After experiencing that unimaginable loss, Martha joined a network of Granite Staters dedicated to suicide prevention and awareness efforts, advocates including a local nonprofit, the Connors Climb Foundation, who have worked tirelessly to raise awareness, increase education efforts, and reduce the stigma associated with suicide. To help build on the brave efforts of these Granite Staters, I'm working to introduce bipartisan legislation that would work to expand access to suicide awareness and prevention training for students. Dr. Benton, can you speak to the importance of providing kids and teenagers with the tools that they need to recognize if they or someone they know is at increased risk of suicide?
Thank you for that question, Senator Hassan. You've asked such an important question. So most of the time, as you know, young people speak to their peers about their suicidal feelings. Yeah. So as much as we discourage young people from going to their peers and asking them to speak with trusted adults, it's not usually the pathway that's taken by most young people. And young people in those situations will tell you that they don't know what to say and they don't know what to do when their peers and their classmates tell them, I feel like killing myself. We've seen tremendous success with peer counselors who work with suicidal youth, but the training is absolutely essential. Training youngsters to know how to respond is essential. Providing opportunities for identification of suicidal youth in all community settings is essential. So in the primary care setting, in the schools, by school counselors, in communities, religious organizations, making that training available in one of its many forms, because there are many training opportunities out there, could save lives. We know that for young people who have suicidal feelings, most of them, more than 50%, have seen a primary care provider within the week before the time they make the attempt. So there are many opportunities to just ask someone the questions, to get comfortable with knowing what to say, understanding that asking a question about suicide won't make that person suicidal is essential to suicide prevention. And as
Thank
you
you.
referenced, the suicide rates for young people have continued to increase. This year, there was data suggesting that suicide rates had decreased nationally, but we've not separated that data for young people versus adults. And what we're seeing on the ground is increasing numbers of young people presenting to emergency departments with suicidal ideation. And I 100% support your assertion that we have to have a public health approach to this problem. That's the way we will end suicide.
Thank you very
I'm
much.
on
Thank
that.
you, Madam Chair.